Osteoporosis. Causes, symptoms and prevention. Osteoporosis is a common disease in middle-aged people, second only to cardiovascular diseases. About 54 million Americans have osteoporosis and low bone mass, placing them at increased risk for osteoporosis. Studies suggest that approximately 1 in 2 women and up to 1 in 4 men age 50 and older will break a bone due to osteoporosis. What is osteoporosis? Osteoporosis, also known as brittle or spongy bone disease, is a health condition that weakens bones, which makes bones more brittle, vulnerable and prone to fracture suffered a minor injury. Bone is living tissue that is constantly being broken down and replaced. Osteoporosis occurs when the creation of new bone doesn't keep up with the loss of old bone. Osteoporosis progresses silently. Often patients only feel pain and fatigue, gradually decreasing in height, kyphosis of the spine. These are manifestations that are only discovered after a long time. Many cases are detected only when there are signs of fracture. It will get worse as you get older. Due to this age, the bone density is not guaranteed to be enough to ensure that the bones are as strong as in adulthood. Causes of osteoporosis. Your bones are in a constant state of renewal. New bone is made and old bone is broken down. When you're young, your body makes new bone faster than it breaks down old bone and your bone mass increases. After the early 20s, this process slows, and most people reach their peak bone mass by age 30. As we age, bone mass is lost faster than it is created, leading to risk of osteoporosis. The main causes of osteoporosis include unreasonable lifestyle, sedentary, constantly carrying heavy objects, doing hard work, have a calcium-deficient diet. Gender. Women are more likely to develop osteoporosis than men. The amount of calcium for bone formation at a young age is not fully supplemented. Symptoms. There typically are no symptoms in the early stages of bone loss. But once your bones have been weakened by osteoporosis, you might have signs and symptoms that include decreased bone density causes a fractured or collapsed vertebra, also known as a settlement fracture. Manifestations of this condition include acute low back pain, decreased height, stooped gait, and hunchback. The pain at the ends of the bones. People who have osteoporosis will feel fatigue along the long bones, even pain like being pricked by a needle all over the body. Pain in the bones that bear the burden of the body such as spine, waist, pelvis, hip bones, knees, repeated pain after injury. The pain is dull, long-lasting and increases with movement, walking, standing and sitting for a long time and will be relieved when lying down. Pain in the spine, lumbar or intercostal sides, affecting the intercostal nerves, the femoral nerve and the sciatic nerve. Pain that worsens with vigorous exercise or sudden changes in position. For middle-aged people, osteoporosis is often accompanied by signs of varicose veins, osteoarthritis, high blood pressure, etc. Who's affected by osteoporosis? There are many risk factors that can lead to osteoporosis. Some factors can be changed while others cannot. Risk factors that cannot be changed include gender. In women, especially postmenopausal women, the risk of osteoporosis is much higher than that of men of the same age due to lower total bone mass. Age. The older you are, the higher your risk of osteoporosis. Body size. Thin and small women have a higher risk of osteoporosis. Family history of osteoporosis or hip fracture. Menopause before age 45. Ever had a broken bone? Comorbidities such as endocrine disease, rheumatoid arthritis, kidney disease or Cushing's syndrome. Caucasian or Asian race. Modifiable risk factors include sex hormones. Low estrogen levels due to irregular periods or menopause can cause osteoporosis in women. Meanwhile, low testosterone levels can cause osteoporosis in men. Diet low or deficient in calcium and vitamin D. Anorexia nervosa. This eating disorder can lead to osteoporosis. Taking certain medicines such as corticosteroids or heparin for a long time. Activity level. Lack of exercise or long-term bed rest can cause weak bones. Smoking. Smoking is very bad for your bones, as well as your heart and lungs. Drinking alcohol. Drinking too much alcohol can weaken bones and make them easier to break. How to prevent osteoporosis. The following methods can help stop or slow bone loss and prevent fractures, but cannot cure osteoporosis. Eat a calcium-rich diet or take a calcium supplement every day. Plus, for adults aged 19 to 50, eat 3 meals or get 1000 mg of calcium per day. Plus, men over 50, eat 3 meals or 1000 mg of calcium per day. Plus, men over 70, eat 4 meals or 1200 mg of calcium per day. Plus, women over 50, eat 4 meals or 1200 mg of calcium per day. Food sources of calcium include milk, dairy products or calcium-rich foods such as juices or beans, fish, and green leafy vegetables. Regularly measure osteoporosis to check bone density. Follow up with scheduled appointments to monitor the progress of symptoms as well as health status. Follow the doctor's instructions. Do not arbitrarily take drugs that are not prescribed or arbitrarily quit prescribed drugs. Regularly do weight-bearing exercises and muscle strengthening exercises as recommended by your doctor. No smoking. Avoid drinking too much alcohol. Drinking more than 2 glasses of alcohol a day can reduce bone formation. Avoid falling. When we need to see a doctor. If you've been through early menopause or have been using corticosteroids regularly, you can talk to your doctor to learn about osteoporosis. If your parents or an older family member has a hip fracture, you should also take them to the doctor for advice and testing about this condition.